What anatomical features increase sleep apnea risk genetically? Imagine your body's blueprint influencing how easily you breathe when you sleep. Some inherited features can make your airway more prone to collapsing, leading to sleep apnea. These traits are often passed down in families and can affect your risk without you even realizing it. One major factor involves the shape of your face and skull. If you have a smaller or set back lower jaw, known as retrognathia or micrognathia, your airway can be narrower. This makes it easier for the airway to close off during sleep. Similarly, an underdeveloped upper jaw or midface, called maxillary or midface hypoplasia, can also reduce the space in your nasal and throat areas. These craniofacial features tend to run in families and are common in conditions like Down syndrome and Marfan syndrome, which are linked to higher sleep apnea rates. Soft tissues in your mouth and throat also play a role. If you inherit a larger tongue, a condition called macroglossia, it can block your airway when you're lying down. Excess soft tissue around the throat, often due to increased fat deposits, can add to the obstruction. Some people have genetic mutations affecting connective tissue, making these tissues more lax and prone to collapsing during sleep. Your genes influence how your body stores fat, especially around your neck and upper airway. Extra fat in these areas can narrow the airway and increase the chance of it closing off. This is why people with a genetic tendency for weight gain in the neck are more likely to develop sleep apnea. Another factor is the balance between soft tissue and skeletal structures. If your tongue is large compared to your jaw size, it can push into the airway and cause blockages. This imbalance varies among different ethnic groups and can influence sleep apnea risk. Finally, the position of your hyoid bone, a small bone supporting your tongue and airway muscles, matters. If it sits lower in your neck, it can make your airway more collapsible during sleep. All these inherited features contribute to a narrower or more flexible upper airway, which is the main physical reason for obstructive sleep apnea. Because these traits are genetic, sleep apnea often runs in families. Knowing about these factors helps identify those at higher risk and can guide treatments like orthodontics or surgery to improve airway size and reduce sleep problems. Understanding these anatomical features shows why some people are more prone to sleep apnea even if they have a healthy weight or lifestyle.